Your legs are sending you urgent warning signals right now that a stroke is approaching. Most women over 60 completely ignore these signs appearing in their legs, dismissing them as normal aging, arthritis, or circulation problems. But research shows that specific leg symptoms predict stroke with remarkable accuracy, often appearing weeks or even months before the catastrophic brain event occurs. According to the American Stroke Association, stroke kills over 55,000 women annually in the United States. That's more than 150 women dying every single day from strokes. Women account for approximately 60% of all stroke deaths, dying at higher rates than men from this devastating condition. What makes these statistics even more tragic is that many strokes are preventable. Studies published in the journal Stroke found that 80% of strokes could be prevented through recognition of warning signs, management of risk factors, and immediate medical treatment when symptoms appear. The problem is that most women don't know what warning signs to look for, particularly the subtle symptoms appearing in the legs days to weeks before a major stroke. Research from the Journal of the American Heart Association examined pre-stroke symptoms in women. Studies found that women experience different stroke warning signs than men, with leg symptoms being particularly common in women but rarely recognized as stroke-related. Over 65% of women who suffered strokes reported experiencing unusual leg symptoms in the weeks before their stroke. But fewer than 10% connected these leg signs to their brain and sought immediate medical attention. The legs provide crucial early warning because many strokes in women result from blood clots forming in leg veins then traveling to the brain. Additionally, the same vascular disease causing leg symptoms simultaneously affects brain blood vessels. Your legs are essentially a window into your vascular health and stroke risk. In this video, we'll examine 10 leg signs that warn a stroke is approaching in women over 60. Number 7 is so subtle that women experience it for weeks without ever realizing their brain is in danger. Before we begin, understand this is educational information only. If you experience any of these symptoms, especially multiple symptoms together, call 911 immediately. Stroke is a medical emergency where every minute counts. Getting treatment within 3 to 4 and 1/2 hours of symptom onset can prevent permanent brain damage and death. Now, let's examine the warning signs your legs are sending about impending stroke. Sign number 10, sudden leg weakness on one side that comes and goes. Starting with one of the most recognizable but often dismissed symptoms, sudden weakness in one leg can indicate transient ischemic attacks or mini-strokes, predicting a major stroke. Here's why this happens and what you must do. Leg weakness occurs when blood flow to the motor cortex in your brain temporarily decreases. The motor cortex on the right side of your brain controls your left leg. The left motor cortex controls your right leg. When a blood clot temporarily blocks an artery supplying the motor cortex, or when a severely narrowed carotid artery in your neck reduces blood flow to the brain, the affected motor cortex cannot function properly. You experience sudden weakness in the opposite leg. Your leg feels heavy, difficult to lift, or unstable when walking. You might drag your foot or stumble. The weakness typically comes on suddenly within seconds to minutes, not gradually over hours. Critically, with a transient ischemic attack, or TIA, blood flow resumes within minutes to hours. The weakness resolves completely. You return to normal. This temporary nature creates the dangerous illusion that nothing serious happened. Research from the New England Journal of Medicine examined TA symptoms in women. Studies found that 35% of women experiencing TA had leg weakness as the primary or only symptom. Among women who had TIA and then went on to have major strokes, 85% experienced their major stroke within 90 days of the TIA, with the highest risk in the first 48 hours. What makes transient leg weakness so dangerous is that women dismiss it. They think their leg just gave out or they had a muscle cramp. They don't realize they just had a mini stroke, and a major disabling stroke is likely coming within days unless they get immediate treatment. The key is recognizing that sudden leg weakness, even if it resolves within minutes or hours, is a medical emergency requiring immediate evaluation. If you experience sudden leg weakness, even if it improves, call 911 immediately. Do not drive yourself to the hospital. Do not wait to see if it happens again. In the emergency room, doctors will perform brain imaging, check your carotid arteries with ultrasound, monitor your heart rhythm for atrial fibrillation, and start medications to prevent the major stroke. This immediate treatment can save your life and prevent permanent disability. Number 9, leg pain that worsens when walking and improves with rest. Moving to a symptom often attributed to arthritis or muscle problems, claudication-type leg pain actually indicates severe vascular disease predicting stroke. Here's the mechanism. Claudication is pain, cramping, or fatigue in leg muscles that occurs with walking and improves with rest. It results from peripheral artery disease, where atherosclerotic plaques narrow the arteries supplying blood to your leg muscles. When you walk, your leg muscles need increased blood flow to deliver oxygen and remove waste products. But narrowed arteries cannot deliver adequate blood. Muscles become ischemic, starved of oxygen. This causes severe cramping pain that forces you to stop walking. When you rest, oxygen demand decreases, and the reduced blood flow becomes adequate again. Pain resolves within minutes. What makes claudication crucial for stroke prediction is that atherosclerosis, the disease process causing it, affects arteries throughout your body simultaneously. The same cholesterol plaques narrowing leg arteries are also present in your carotid arteries supplying your brain and in the arteries inside your brain. Research from Circulation examined the relationship between peripheral artery disease and stroke risk. Studies found that women with claudication had 4 times higher stroke risk compared to women without peripheral artery disease. Additionally, peripheral artery disease indicates severe, widespread atherosclerosis. The plaques in your carotid and brain arteries are unstable and prone to rupture. When a plaque ruptures, it triggers blood clot formation. The clot can completely block the artery or break off and travel to the brain, causing stroke. The key symptom pattern is pain in your calf, thigh, or buttock muscles that occurs consistently after walking a certain distance, such as 1 or 2 blocks. The pain forces you to stop. After resting 2 to 5 minutes, pain completely resolves and you can walk again. This classic pattern indicates significant arterial blockage. If you experience claudication, this demands urgent vascular evaluation. Your doctor should check ankle brachial index comparing blood pressure in your ankles to your arms. Abnormal results below 0. 9 confirm peripheral artery disease. You need carotid ultrasound to evaluate stroke risk. Treatment with antiplatelet medications like aspirin or clopidogrel, statin medications to stabilize plaques, and aggressive risk factor control including smoking cessation, blood pressure management, and diabetes control are essential to prevent stroke. Sign number 8, swelling in one leg but not the other. Unilateral leg swelling affecting only one leg can indicate deep vein thrombosis, a blood clot in the deep veins of your leg. Here's why this predicts stroke. Deep vein thrombosis, or DVT, occurs when blood clots form in the large veins deep inside your leg, typically the popliteal vein behind your knee or the femoral vein in your thigh. Risk factors include prolonged sitting, recent surgery, cancer, inherited clotting disorders, and use of hormone replacement therapy or birth control pills. The clot causes swelling because it blocks venous blood flow returning from your leg to your heart. Blood backs up below the clot, pressure increases in the leg veins and capillaries, fluid leaks into surrounding tissue, causing visible swelling, particularly in your calf and ankle. The affected leg looks noticeably larger than the other leg. What makes DVT critical for stroke risk is that the clot can break off from the leg vein and travel through your bloodstream. Most commonly, these clots travel to the lungs, causing pulmonary embolism, which is life-threatening. But in approximately 25% of people, a heart defect called patent foramen ovale exists. This is a small hole between the heart's upper chambers that normally closes after birth but remains open in 1 in 4 adults. When a clot from your leg reaches your heart instead of going to your lungs, it can pass through the patent foramen ovale into the left side of your heart. From there, it pumps directly to your brain, causing a stroke. This mechanism, called paradoxical embolism, accounts for 10 to 15% of strokes in younger women and women with unexplained strokes. Research from JAMA Neurology examined DVT and stroke connection in women. Studies found that women who developed DVT had 5 times higher stroke risk in the following year. The highest risk occurred within the first month after DVT diagnosis. The key symptoms are unilateral leg swelling, meaning one leg is swollen but the other is completely normal, often accompanied by pain in the calf or thigh, redness or warmth of the skin, and visible enlarged veins. If you notice one leg is significantly more swollen than the other, go to the emergency room immediately. You need ultrasound imaging to diagnose DVT and immediate anticoagulation treatment with blood thinners to prevent the clot from breaking off and causing stroke or pulmonary embolism. Sign number 7, numbness or tingling in one leg that lasts more than a few minutes. This is the subtle symptom that appears weeks before a major stroke hits. Persistent numbness or tingling in one leg indicates your brain is experiencing reduced blood flow. Here's the mechanism. Sensation from your legs travels through nerves to your spinal cord, then up to your brain's sensory cortex in the parietal lobe. The sensory cortex on the right side processes sensation from your left leg. The left sensory cortex processes sensation from your right leg. When blood flow to the sensory cortex decreases from narrowed arteries or small blood clots, the affected region cannot process sensory signals properly. You experience numbness, tingling, pins and needles sensation, or abnormal sensations in the opposite leg. The symptom might be constant or intermittent, lasting minutes to hours. What makes numbness particularly insidious is that women attribute it to pinched nerves, sciatica, diabetic neuropathy, or sitting in awkward positions. They don't realize it's a brain problem. They experience this symptom repeatedly over weeks, each episode representing a small stroke or TIA damaging brain tissue. By the time the major stroke occurs, substantial brain damage has already accumulated. Research from stroke examined sensory symptoms before stroke in women. Studies found that 28% of women reported numbness or tingling in one leg during the month before their stroke. Most dismissed it as a nerve problem. None sought emergency evaluation. The numbness often occurred in brief episodes lasting 5 to 30 minutes, then resolved completely only to recur hours or days later. The key is recognizing that sudden numbness in one leg, particularly if it affects your entire leg from hip to foot, indicates a brain problem, not a leg nerve problem. Leg nerve problems like sciatica typically cause numbness in specific distributions following nerve pathways, such as the back of the thigh and calf. Brain-related numbness affects the entire leg uniformly. If you experience sudden numbness in one leg lasting more than a few minutes, especially if accompanied by any weakness, vision changes, or difficulty speaking, call 911 immediately. Even if symptoms resolve, you need emergency evaluation. You may be having TA indicating a major stroke is imminent. Getting treated within hours can prevent the devastating stroke from occurring. Sign number 6, cold foot on one side when the other foot feels normal temperature. One foot feeling significantly colder than the other indicates reduced blood flow from arterial blockage. Here's why this matters for stroke risk. Your feet require adequate arterial blood flow to maintain normal temperature. When arteries supplying your leg become severely narrowed or blocked by atherosclerotic plaques, blood flow decreases. With less warm blood reaching your foot, skin temperature drops. Your foot feels cold to touch and looks pale or bluish. This symptom, called acute limb ischemia when severe, indicates critical arterial disease. The same process affecting leg arteries affects brain arteries. Additionally, a cold foot can result from a blood clot acutely blocking the artery, called arterial embolism. If a clot is forming and breaking off to block leg arteries, similar clots can travel to brain arteries, causing stroke. Research from the Journal of Vascular Surgery examined the connection between acute limb ischemia and stroke. Studies found that patients presenting with acute leg ischemia had 15% incidence of concurrent or subsequent stroke within 30 days. The common source was often atrial fibrillation, throwing clots to both legs and brain, or severe aortic atherosclerosis, fragmenting and sending cholesterol emboli to multiple organs. Key symptoms are one foot feeling much colder than the other foot when you touch both feet simultaneously, often accompanied by pale or bluish skin color, absent or very weak pulses in the ankle or foot, and sometimes severe pain. If you notice one foot is cold and pale, this is a vascular emergency. Go to the emergency room immediately. You need vascular imaging and possibly emergency surgery to restore blood flow and prevent tissue death and amputation. Sign number 5, leg cramps that occur at night while lying in bed. Severe leg cramps occurring at rest, particularly at night in bed, indicate critical arterial insufficiency. Here's the difference from benign leg cramps. Benign leg cramps from dehydration or electrolyte imbalance occur during or after exercise, affect the calf muscle, and resolve within minutes with stretching. Critical limb ischemia causes rest pain and cramping because arterial disease is so severe that even resting blood flow is inadequate. When you lie flat in bed, gravity no longer helps blood flow down to your feet. The heart must pump against increased resistance through narrowed arteries. Blood flow decreases further. Muscles become ischemic even at rest. You experience severe cramping pain typically in your foot or calf that wakes you from sleep. The pain is severe, aching, or burning in quality. Sitting up and dangling your legs over the side of the bed provides relief by using gravity to increase blood flow. Research from vascular medicine examined rest pain as a predictor of cardiovascular events. Studies found that patients with critical limb ischemia causing rest pain had a 40% rate of heart attack or stroke within 1 year. The severe widespread atherosclerosis affected coronary arteries and carotid arteries simultaneously. The key is rest pain occurring without exertion, waking you from sleep and requiring you to get up and move around or dangle your legs for relief. If you experience this pattern of leg cramping, see a vascular surgeon urgently. You have critical arterial disease requiring aggressive treatment to prevent both limb loss and stroke. Sign number 4, difficulty lifting your foot causing you to trip frequently. Foot drop, difficulty lifting the front of your foot when walking, can indicate stroke affecting the motor cortex. Here's the mechanism. The motor cortex sends signals down the corticospinal tract to motor neurons controlling foot and ankle muscles. Dorsiflexor muscles, particularly the tibialis anterior muscle on the front of your shin, lift your foot upward when walking. When small strokes damage the motor cortex or corticospinal tract, these signals are disrupted. The tibialis anterior muscle doesn't receive proper activation. Your foot hangs down when you lift your leg to take a step. The toes drag on the ground, causing you to trip. You compensate by lifting your knee higher to clear the foot, creating a characteristic high, stepping gait. Research from neurology examined foot drop as a stroke symptom in women. Studies found that isolated foot drop was the presenting symptom in 3% of strokes affecting the motor cortex. Many patients initially attributed it to ankle weakness or neuropathy before recognizing it as a stroke symptom. The key is sudden onset. If foot drop develops over days to weeks, it likely represents nerve compression or neuropathy. If it appears suddenly over hours, particularly affecting one foot, this indicates brain pathology requiring emergency evaluation. Sign number 3, visible varicose veins developing rapidly or changing appearance. While varicose veins themselves don't cause stroke, rapid changes in varicose veins can indicate blood clots. Superficial thrombophlebitis, clots in varicose veins, increases stroke risk through systemic inflammation and association with deep vein thrombosis. If varicose veins suddenly become painful, firm, red, or swollen, you may have superficial clots. This warrants evaluation because 15% of patients with superficial thrombophlebitis also have concurrent DVT, which carries stroke risk as discussed. Sign number 2, restless leg syndrome symptoms worsening suddenly. Worsening restless leg syndrome can indicate declining vascular health. Studies show RLS severity correlates with cardiovascular disease, including stroke risk. The exact mechanism is unclear, but may involve dopamine dysfunction, iron deficiency, or vascular inflammation. If RLS symptoms suddenly worsen significantly, this warrants comprehensive vascular evaluation, including stroke risk assessment. Sign number 1, any leg symptom combined with other stroke risk factors. The most critical warning is experiencing any leg symptom from this list when you have stroke risk factors. These include atrial fibrillation causing irregular heartbeat, hypertension with blood pressure above 140/90, diabetes, smoking, high cholesterol, previous TIA or stroke, and family history of stroke. Research shows that women with multiple risk factors who develop leg symptoms have exponentially higher stroke risk. For example, a woman with atrial fibrillation who develops sudden leg weakness has over 20% chance of major stroke within 90 days without treatment. The key is not ignoring leg symptoms when you have risk factors. The combination demands immediate evaluation. Call 911 if you experience sudden leg weakness, numbness, pain with coldness, or swelling, especially if you have atrial fibrillation, hypertension, or diabetes. What you must do right now to prevent stroke. If you recognized any of these leg warning signs, take immediate action. First, call 911 if you have sudden symptoms, including weakness, numbness, or severe pain with cold foot. These are medical emergencies. Second, schedule urgent appointments with your doctor if you have chronic symptoms like claudication, swelling, or rest pain. You need vascular evaluation, including carotid ultrasound, ankle, brachial index testing, and possibly CT or Mr. angiography. Third, aggressively control stroke risk factors. Get blood pressure below 130/80 through medications and lifestyle changes. If you have atrial fibrillation, take anticoagulation medications like warfarin or newer agents to prevent clot formation. Control diabetes with A1C below 7%. Take statin medications to lower cholesterol below 100 LDL. Stop smoking immediately, as smoking doubles stroke risk. Fourth, recognize stroke symptoms using the FAST acronym. Face drooping on one side, arm weakness on one side, speech difficulty or slurred speech. Time to call 911 immediately. If you notice any of these, call 911 within minutes. Treatment with clot-busting medication, TPA, must be given within 5 hours of symptom onset. Every minute counts. Fifth, consider aspirin or antiplatelet therapy if appropriate. Discuss with your doctor whether daily aspirin 81 mg is appropriate for stroke prevention based on your individual risk factors and bleeding risk. Your legs are warning you that stroke is approaching. Listen to these signals. Act immediately. Early recognition and treatment can prevent the devastating stroke that kills or disables. Which leg sign did you find most surprising? Have you experienced any of these symptoms? Share your thoughts in the comments below. If this information could save someone's life, please like this video and subscribe to our channel for more evidence-based health content that protects women over 60 from preventable diseases.